Hello everyone, good day. On this video, I'm going to be teaching you how to give a rectal suppository, how to insert a rectal suppository. Now bear in mind that a lot of equipments aren't present, aren't available, so there will be a lot of improvisation. Now to insert a rectal suppository, there are certain equipments you're going to need. And so as I said, there's a lot of improvisation. So firstly, you have to have your disposable gloves. Also have to have a toilet tissue or a toilet paper, your lubricant, your wrapped suppository drug, bed protection, and a bedpan and its cover if needed. The next thing to do is to slip the bed protection under the patient's hip. Having done this, the next thing to do is to turn your patient on the patient's left side and flex the patient's right leg. Flex the right leg, put it in front. Good. The next thing to do after this is unwrap the suppository. After unwrapping it, the next thing to do is slip the patient's bed cover to expose only the patient's buttocks. Having done this, you use your left hand to hold the buttocks and expose the anus. After doing this, you oil, you lubricate the anus, you apply a little lubricant to the anus and also to the suppository. Then you insert the suppository gently 2 centimeters above the anal sphincter. While doing this, you have to tell the patient to take deep breath. Even after doing this, to take deep breath and be calm until the need to defecate is felt in 5 to 20 minutes. Please do not forget to wash your hands. Then you assist the patient in making his bedding and also help the patient assume a comfortable position on the patient's bed. Then you place a signal cord next to the patient's hand. You check on the patient every 5 minutes and you come back immediately the patient signals. Once the patient signals, you wash your hand, put on the gloves, you help the patient to the toilet or you provide the patient with the bedpan. Afterwards, you give the patient privacy. After the patient is done, you come back, help with the patient's hygiene if necessary, and then you examine the stool if it is normal or abnormal. If it is abnormal, then you have to save it and inform the nurse. Afterwards, you discard the stool, you clean equipment and store every reusable equipment or item, and then you carry out the ending procedures. Thank you for watching this video.